Tim Smith is a cooperative 8-year-old boy attending your clinic today for the first time with his father. Mr. Smith is concerned about Tim's teeth turning black. He is a single dad and works full time, and Tim is looked after by his grandparents. On examinations, you found caries on first permanent molars, primary molars, and primary canines. Consent with the parent about the caries risk assessment.
The pointers here are we focus on oral hygiene practices, the importance of a diet chart, explain risks and complications of leaving teeth untreated, prevention and maintenance while highlighting importance of regular dental visits. Let's dive into the role play now. Well done to little Tim. While I was having a look through his teeth, he did really well today.
Yeah, he's a good child.
You must be really proud of him.
Yeah.
That's excellent. So now I'll just discuss about what we've seen today, Mr. Smith. I do have a few questions for you. Is that okay?
Yes, sure.
Sure. So at the moment, is he in any sort of pain? Does he have any problems with eating or drinking?
He hasn't really complained about anything like that thing.
That's good. Any mood changes? Is he himself in general?
Yeah, he's generally like this. Yeah, pretty cool.
Good. That's good to hear. Any medical problems that you're aware of?
No medical problems. No history, nothing.
No? And any allergies?
Nothing that I know of.
Okay, that's good. How soon does he see a dentist generally? What's his frequency like?
This is actually his first visit.
Fantastic. That's good. So has he ever seen a dentist even in the past when he was...
No. You're the first one he's seeing.
Ah, okay. Yeah, that's good. He's done really well for his first visit. So now I just also wanted to know what sort of oral hygiene practices do you follow at home? How many times does he brush? What sort of a teeth brush does he use?
He brushes once a day, I guess. I'm not really sure. I've seen him doing that. And he brushes with our store-bought brush, a regular one that all of us use.
Okay, yeah. Does anyone supervise him while he's brushing?
I don't think his grandparents have the time for him.
Okay, yeah. I would recommend that someone supervises him while he's brushing, especially because today we have seen holes in his teeth. So the concern that you had about the appearance of his teeth, I have found that there were a few holes in his teeth, and some of them are his adult teeth. And that's why we need to be more attentive now. So it is definitely recommended that, I know you are probably really busy with your work, but if any one of you can supervise him while he's brushing, definitely twice a day. That's my strong recommendation. And probably switching to an electric toothbrush is also a good idea, something that you could look into in future.
Yeah. I'll make some time and definitely electric toothbrush.
Yeah, definitely. Now, with regards to his diet, what sort of a diet does he normally take? What if you were to describe his typical day, what sort of food does he eat in a day?
He eats what he likes. His grandparents are pretty lenient with him. Then he eats some bread and some meat and some vegetables like all of us do.
Okay, that's good. I will give you a diet chart today because this is also something that we need to really stay on top of. I do need to know what does his typical diet consist of. This will track his meals for a week, and that way I'll know what is going in, and we'll also then have a better idea as to do we have to modify his diet to prevent these holes from getting worse or new holes from appearing as well. So I'll provide that today with you after the appointment. Okay.
Is it a very complex piece of thing? Because I don't know if I'll have the time for all this.
No, I completely understand. It's really very simple. All you have to do is just document every meal that he has and every drink that he has as well. It can be water, it can be juice, it can be anything, but it just needs to be documented.
Okay.
So it's more it's neatly well presented for you as well. It's easy for you to just enter everything into it. Okay. So it's more like a diary. So you just maintain it and bring it back to us to the next appointment.
Okay, sure.
Okay. Now with regards to water, what sort of water do you guys drink?
Just some bottle of water.
Okay. So do you have access to tap water at all?
Yeah, we do, but we've never really liked the taste, so
Yeah.
I'm used to the bottled now.
Right. Okay. So we'll discuss about that as well towards the end of the appointment, why it's important to have the right kind of water and how water can also play a role in, preventing these holes. Okay. So now I'm just pointing you to the pictures that we've taken today. So it shows can you see those holes there around the teeth there? Yeah. So these holes are basically what happens is we all have sugar in our diets, but there are certain bacteria which actually they rely on the sugar as their food source. They break it down to form acid, and this acid can actually destroy our teeth. So that's the reason why it's important that I go through this diet chart once you have it filled for me, because then we know what's the amount of sugar that's affecting the bacteria and the teeth. All right.
Okay, yeah.
Now, the other things that I would like to do today is we will have to take a couple of x-rays for his teeth.
X-ray.
Yeah.
Isn't he too young for some X-rays?
At this stage, it's more about requirement for going further. We do need to do x-rays to find out how deep are these holes. So he's young, but not too young for us to not do anything about it. And the x-rays that we do these days, they have very less exposure time, so it poses very less risk to anyone. So it's completely safe. We can definitely do it. So, and in our case, we do need it to see further as to what's happening with his teeth, because we don't want the holes to be too deep that it affects his nerve around those teeth, and that can actually cause pain.
Okay.
So, an infection as well. We don't want that.
As long as it's not causing any more problem, I think
Yeah.
can go with some.
Yeah, we do need to do that. And once we've finished with that, the first step that I'd like to do today is treat those holes. So we should be able to fill them. And once we do that, I would like to go again throughout about the oral hygiene practices, the brushing, the techniques, and also the importance of regular visits. It's great that today is his first visit, but it's very important that we see you regularly from now on to prevent these things from happening again. The last thing I would suggest that we do for him today is we also can place a preventative coating on his permanent teeth, the adult teeth, because they have nice deep grooves, but some of them are also starting to show early decay. So we can put fissure sealers, that's what we call them. They actually help to prevent any further decay.
Okay.
Yeah. So once we do that, I'll give you the diet chart, and then we will definitely see you again.
Okay. Okay.
And do you have any other questions for me, Mr. Smith?
Yeah, you said that you would tell me something about water and how that's, causing all this decay in my son.
So the importance of water, especially here in Australia, is that we need to have fluoride in our water. So the fluoride component is very, very important for helping our teeth stay away from holes, but also strengthens our teeth. It helps the enamel to get stronger. So that's the reason why I was asking you what sort of water do you have. Bottled water is great. I agree the taste is good, but I would highly recommend we switch to tap water for now, because the fluoride in that water will also prevent these holes, and it's good for everyone in the family to have tap water as well.
You reckon they can, better the taste of the water? It's not really great. It's really bad. And, we've been trying our whole life to try and drink the tap water. I can't expect an 8-year-old to, suddenly start liking that taste.
I agree, but I wouldn't encourage you to add anything to the water to make it sweeter or anything, because that's only just going to make it worse. You could flavor it with natural fruit a little bit, or just flavor it with a little bit of a lemon or things like that. Just any natural flavoring is okay, but do not sweeten it. But I would definitely encourage tap water.
Well, we'll see what we can do about that.
Yeah. So there is another product called tooth mousse. You could get this off at any supermarket or even from the chemist. So this contains a little bit of milk protein and also reinforced with fluoride. So after he has brushed and flossed for the day, before he sleeps, it's a good idea for him to apply that on his teeth and just leave it on his teeth. And that will help also to prevent decay.
Okay.
All right.
Yeah.
So is everything clear for you so far, Mr. Smith?
Yeah.
All right. I do understand it all seems like it's a lot, and especially because you're
Quite
busy.
but then,
Yes, yes. I'll definitely provide you with a diet chart today, and we'll finish with the first steps of filling and maintenance today, and we will bring you back in once we have the diet chart.
okay, yeah, sure.
All right.